N99.
Actually, we have real masks.
Yeah, that's not how the
This is the
song
mask
goes.
I was using from before the recommendation for people who aren't suspected to be infected with COVID-19. As a way of
Right.
introducing ourselves, I'm Dr. Mark Vaughan,
Yep, Dr. Gawayne Vaughan.
and we are the Auburn Medical Group, or at least the physicians at the Auburn Medical Group. And the program is produced by the Auburn Medical Group. Welcome to our regulars and to our newcomers. We are going to be talking about COVID anxiety. We need to really make sure that they know our faces don't look anxious. Should we have drawn like faces?
Just a meh face.
Meh. I'm not anxious. Meh.
Meh.
One of the things,
Meh.
one of my priorities now, which is kind of easy because it's before it really hits, at least in our county.
All right.
Not so much for some other counties in the U.S. or other parts of the world for that matter. But what I'd like to do is make this a fun one
Okay.
because we need that.
Yes. Yeah, it's if you look at the news, it's pretty easy to become anxious
It is.
and to be
tell us-
overwhelmed.
Tell us about that, Dr. Gawayne.
Yeah, so we've been seeing a lot of anxiety. I don't know if you have, but I have a lot. And most of those have been through telemedicine visits. I actually had two anxiety visits, and I think 2 or 3 last week. So a lot of people are anxious about what's going on. And a lot of them you talk to, they've been watching a lot of the news, and I mean, rightfully so. This is an anxiety-provoking thing, especially with somebody who has any underlying anxiety. This is going to heighten that to a certain extent. It can seem like it's the end of the world. I mean, there are a lot of unprecedented things going on, and that can make you anxious. So I've been trying to talk people down, first of all, as best I can, while still being realistic and making sure that they're adhering to guidelines about social distancing and washing their hands and playing and staying safe, wearing face coverings when they go out. But a lot of people are heightened, and I've actually even needed to try some very mild anxiety medications. Nothing severe, but stuff to kind of calm them down. Or those on anxiety medications, I bumped them up a little to try to help them deal with anxiety through this time. So, yeah, that's been my experience.
Okay.
Have you seen any of that at all?
Yeah, not as much as you have. Of course, I've been out actually from seeing the patients here just the last week because the volume inside the office has plummeted, even with telemedicine, even though telemedicine was actually most of what I've been doing when I have been in the office.
Probably about half of my visits.
Yeah, half or more of the most recent days that I've seen patients. Most of the time I'm getting the telemedicine working or coordinating with people outside of our office as we get ready for the surge is the term some of us are using for it when it will hit.
Preparing for that, yep.
That's what could be anxiety provoking. I'll admit I had some anxious type thoughts when I started really thinking in terms of what's going to happen the next 3 weeks or so.
Right. Yeah, you stop and perseverate on it, you can very quickly go down a bad hole.
Yeah, it's good to be aware of it and to be preparing for it responsibly. Not good to perseverate and, like you said, go down the hole of
I mean, what do we want to call it? The heightened sense of urgency from our leaders, I think, is a good thing. And hopefully that is getting through to the vast majority of our population. And I think we're seeing that because people do need to know that this is serious and this is something where we need to adhere to all of those social distancing things that we're talking about, and just to be safe and to protect the older people in our population mostly.
Yeah.
But along with that seriousness can come some anxiety, some
So I show visually a little bit of what we're dealing with here.
Yeah, so let's take a look at that.
Let's take a look at our waiting room. Our waiting room is empty.
Hey, it's empty.
It's empty.
Is this a live shot?
And it
very well could be, because that's what it looks like.
It's empty, and we have the big taped out rectangle in front of the desk for the 6-foot distance that we want to keep. And then I also got a little picture of looking into Rena's office, and the reason I did that was because, well, she's not here on Mondays during this time. And Ian, his desk also. That room that normally has 2 people working all day long, it's
sitting empty.
It is sitting empty currently. Let me adjust this while you
Oh.
talk a little bit more about
Okay.
the empty room.
So yeah, we have had a low census, but part of that is intentional to try to protect ourselves and protect our patients. You saw that taped off area in the a waiting room, and we have taped off areas just to maintain that 6 feet. We're keeping our patients only one at a time to bring them in to make sure that they're not, coming in contact with other patients. Because though we're really only bringing people in through the main entrance without symptoms, the most current data tells us that you can shed the virus for a few days before you start to show symptoms. And that's why we're wearing these masks.
That's why we're doing this, to protect.
This is to protect other people. I'm not wearing this for my protection from you or anybody else. It's to, if I am breathing or talking, I am expressing small little droplets that are going into the air. And I do not want those to get close to other people if by chance I'm infected and in 2 days are going to have symptoms.
Yeah.
So.
And that's why I'm wearing mine, and I wear it home. I'm still...
You wore it when you came to my house the other day.
I did.
He came to my house. No.
Well...
Actually, it was just to drop off something. It was
I
a
wasn't in the house.
it was a very quick, here, drop this off, bye.
I don't know that I was any closer than I am now. Maybe I was a little.
Yeah, I don't think we came within a
Picking
few
that
feet.
up.
You definitely didn't touch me.
No.
Nope.
And I'm
No
debating whether or
contact.
not to wear this for my run home today.
Running with this on, that would be interesting. I've been running. I've still been running in the morning. There's nobody out when I run, so I don't wear one.
Yeah, that's kind of what I'm thinking is I'm not going to be around any people.
I do not come
I run
within
along the side of the road and
6 feet of anybody.
the sidewalk, and
Yep.
there's no people until I get in the house. And then when I get in the house, I would wear it because I don't want to be
Just
around
put it in
my
your
family
pocket
members.
and pull it out.
Yeah, I might do that.
Yeah.
Um,
Just Bianca, hello.
Oh yeah,
She is
our viewers.
watching. She's the
This
only
is
channel
live.
member that I've seen thus far, but thanks for tuning in, Bianca.
Bianca, we are glad that you are here representing channel members. Good job. I guess
Yep.
it's probably partly because we're a half hour early this week, and that's because the office will be done with patients.
Yeah,
early.
I am done with my patients.
We don't have any more that we could have come in for something.
Right. Yeah.
Not that we don't have patients, it's that we're asking them not to come in if it's something that can wait, or to do telemedicine. And a lot of the patients are taking upon themselves to reschedule or cancel appointments out of wanting to not go out. And this concern about, I've heard this, concern about coming to a medical establishment, whether it be the lab or to get imaging done or to have even a procedure for diagnosing what looks to be cancer. People are nervous about coming to the hospital for,
Right.
or our office because of COVID-19. Well, those viewers who are our patients, we can tell you, pretty low risk. You saw
Right.
that waiting.
Well, definitely at our
So-
office, but even at the hospital, they have a very strict procedure in place to make sure that if you have any symptoms, you're kind of routed a certain direction. They catch you
Yes.
before you even get to the door.
They're set up for it.
Yeah, to make sure that
They really are.
we are keeping everyone who does not have any symptoms safe. So,
And going back to the anxiety,
yeah.
I'd like to review that again, these important things that we want people to do instead of drugs and alcohol
For anxiety, to treat anxiety.
for anxiety.
Yeah.
And you were talking along the lines of mindfulness,
Right.
meditation, prayer,
Sure. Exercise.
fasting from news.
Oh, man.
Or
At this point,
paying
that's a good
attention
thing.
to where you're getting your news. If you find yourself getting really worked up and anxious and scared, you're probably watching news programming. And it can be either from the left or the right. I'm not going to, be political here. I'm going to say the extremes. We'll say that. Wherever it is you're getting your news, you can have this emotionally charged language and this doom and gloom and end of the world type of slant to what's
Right.
going on. Whether they say the Republicans are responsible or the Democrats are responsible for
Right.
COVID, as if they invented it or something.
Yeah.
So if you find that for whatever reason, you like that news source that's just inciting anxious thoughts and feelings, please find another place to get your news. And also, maybe it'd be good to purposely limit how much news you take
Right.
in.
Yep.
Maybe pick a particular few sources. I don't say one source.
Probably a good idea.
I'm smiling behind the mask. Probably not just one source, but when you do, limit it. You know, if it's online, maybe just once a day look at it. Or if it's on television, say I'm going to watch this one program. Not that I want you watching television all day long to make it more than one source. Then maybe I messed up.
Well, yeah, what I would recommend is if you are watching something, I would not watch anything more than twice a day. Maybe morning, maybe evening. If at that point you're going to get the news for the day, what happened overnight, you're going to, if there's any big update like, hey, start wearing your face coverings, you're going to catch that or be 12 hours behind. At most.
Yeah.
So I think that's what I would recommend. And even then, when you do watch it twice a day, don't watch it for hours on end. Just watch one program.
I only watch it twice a day.
One that you trust. And yeah, when I say trust, you know, everybody has their biases, but
really.
But yeah, I try to back off because you know you can very quickly go into that doom and gloom scenario, and your anxiety can be heightened, and that can show itself in many different ways, even ways that can affect your health adversely. So
I'd like to go over some places where people can go for resources for either the meditation or the mindfulness.
Oh, yeah.
There are a lot of apps for your mobile devices. You can do searches online for mindfulness and for mindfulness training and for, if you really want to go into it, cognitive behavioral therapy.
Mm-hmm.
These are things that can be done for less severe anxiety. Now, people who are severely anxious, particularly with physical symptoms, if your heart's racing or you're feeling short of breath, you should probably get evaluated if you can't calm that down yourself, rather than just going on feeling that way.
Right. Yeah, I'm wholeheartedly on board with that. There are plenty of sources. I mean, if you just look in your app, whatever the app store, there's plenty of things. Breathe to Relax is a good one that I use for deep breathing. A lot of mindfulness and meditation out there. Headspace, Calm. I mean, there's plenty of them.
Yeah.
Just find your favorite and do it. I guess that's the big thing. Don't just download. Just downloading it on your phone will not help. You actually need to open it up and go through what they're telling you to do.
Okay. Yeah. Let's see if we have any really good comments there. I was going to mention our mugs are available. And in fact, not only are they available, the price got dropped online on YouTube that people can see. I'll show you what both sides of it look like here so you can tell that it's a quality product that you want to have in your home.
Everybody should have one of those.
You should be drinking a hot beverage out of this right now as you're watching the Auburn Medical YouTube channel.
It's a good place to put your tea.
Am I convincing?
When you're at home self-isolating with the coronavirus.
That's right, self-isolating. That's nothing better than the Auburn Medical Group.
Can be delivered to your door.
And if
these things are great.
And if they send in a picture on Instagram with their mug.
Oh yeah, that's right. We'll
put it on the show.
We'll put it on the show. You can have your 15 minutes
Dr. Vaughan.
or 15 seconds.
Okay. All right. Do I have other pictures I want to show? Not
really.
Laura
Spurs showed up. Thanks for showing up, Laura.
Okay, thank you, Laura. Good. Yeah, we're just really early today, and again, it's because the volume was so low.
Right.
Okay.
What else we been talking about? I think Bianca made a mention that her prime minister is currently in the hospital.
Prime Minister Boris Johnson?
Yeah, he's got the coronavirus, and his symptoms apparently have been going on longer, so they admitted him. She says ICU. I didn't hear that, but maybe he's in the ICU. That's worrisome. So, yeah.
We don't want him in the ICU.
Yeah.
Okay.
Well,
and we have several political leaders who are
sick as well or
usually
self-isolating.
Home. I haven't heard of so many being hospitalized.
I haven't heard of any big ones.
I heard of a doctor, Kaiser in San Bernardino, was hospitalized.
Oh, okay. Yeah, there was an ER doc up in Washington when it broke out that was hospitalized. I think he's recovered now. Again, if you didn't catch it early, we're wearing masks, and one of the big recommendations by the CDC is that you should be wearing a face covering
when outside of your home.
So let's. Did we talk a little bit about what a face covering is? Did you talk about that last time?
No.
Yeah. So we wear masks here just because that's what we have access to, and I'm just going to take mine home and clean it, get a new one tomorrow. But that's not what's recommended for the general public.
Unless they have them.
I guess if you do have them, go for it. Wear it. But most people don't. And if you don't, you're not out of luck. You can use a number of things. Actually, a lot of the people who sew have started making masks that can cover. Actually, my wife is getting some of those from her friend who is a sewer. So those work. They say you can use a scarf or a bandana. Good news, the grocery store will not think you're robbing them if you walk in with a bandana over your head and over your face anymore, because everybody's supposed to be doing it. Yeah, it was kind of funny. I saw a bunch of Facebook posts on people wearing, their bandanas like they're going to rob a store. They're saying, don't mind me, just go to the grocery store, just going out. So anything that can just cover, and that is what, what's recommended. So just something to cover. And what that is for other people's protections, not for yours, just to kind of isolate those droplets that may be coming out of your mouth, those microscopic droplets. So, yeah.
Good.
There you go. So, wear it.
Yes.
Wherever you are. Any country, I probably at this point should be wearing a face covering.
Yeah, I'm glad that you remembered to talk about the face coverings, because we do want to have everything being done that we can to limit spread of the virus.
Yep. So,
did you want to
big comments there?
Did you want to thank anyone?
Oh, absolutely. Yeah, so over at drgreenknight.com, had a special post today. Every once in a while I do a prayer, and this one was specifically about the coronavirus and kind of just a prayer of lament. We're going through a rough time, and right now it's just a cry out. So check that out. I do want to thank my patrons who make that possible. Boo Boo Kitty and Teresa, thanks. You make that possible.
And I'd also like to thank Lindsay Antoine. Thank you, Lindsay, for helping make this possible. So, until next time.
Yeah, hey, I'm Dr. Gawayne Vaughan.
Dr. Mark Vaughan telling you to stay well and
wear a face covering.
And that too. And
wash your hands.
Wash your hands.
And don't touch your face.
Social distance.
And stay in good health.
We're social distancing.
as we move off screen.